girls going to school in the coastal part of Kenya, especially in the rural parts where people cannot even to buy a packet of a sanitary towel that costs like $1, but people are not even able to afford, because if you get this $1, do you go buy food or do you go buy sanitary towels?
Because of the national health insurance that Ghana will run, people in these settings come to the hospital with the intention that I don't have to pay anything. And because the government, through the Ministry of Health, has not been disbursing the funds very early, what happens is that even though you are critically ill in the rural community, what the facility can give you is maybe paracetamol.
Welcome to another edition of the Break It Down podcast. This is a special episode we call Journal Conversations, where we have conversations with journalists, colleagues across the continent to get a sense of what they are seeing, what they are experiencing, and what they are reporting across various health issues. The Break It Down podcast is a product from Nigeria Health Watch, and we use this to promote cross-learning, because we believe through the journal conversations, we're able to interact, we're able to engage, we're able to learn from colleagues around how different, African countries are responding to various health issues, because we believe strongly that solutions are not you can't find solutions just in one place, right? As we are experiencing these issues, maybe Senegal is experiencing it, maybe Rwanda is experiencing it, maybe Ghana is experiencing it, and we are all making efforts to address them. So the idea now is, how do we make sure that we are learning, we are engaging, we are having conversations around those issues, and journalists are in the best position to do this. Yes, we talk to the public health experts that are also in the front lines, of responding to all of these health issues. But journalists are also on the front lines, right? Engaging, interacting, researching, investigating all of these issues. So yeah, that's why we are here. And on today's edition, I'm really excited to have two amazing colleagues from Ghana and from Kenya. I'll let them do the introductions themselves, but we're here to talk about a very important issue, right? That we all know everybody has been talking about in the continent, for the past 3 months since February 2025, which is the funding cuts and all. But interestingly, these conversations are not new, right? We've been saying this for a while now, those in the public health advocacy space, that funding is declining. The countries are reducing their development assistance and all. But we now saw this happen so abruptly that it's now affecting a lot of things, especially around access to healthcare. So to break this down, I'm really excited to have these two amazing colleagues to share what they are seeing in their countries and how their countries are responding to it. So yeah, welcome to today's podcast. Aisha, are you there? How are you feeling today?
Yes, I'm here. I'm feeling quite good. Yes, I'm okay. My name is Asha Bekidusa. I'm a journalist from Kenya. Currently, I contribute for Willow Health Media as a multimedia journalist. I'm very glad to be here. Looking forward to this conversation because it's an important conversation, something that we've covered, but we rarely get to talk about it on such platforms.
Absolutely. And that's really why this conversation is important, because yes, we are reporting them in our own different spaces, for our different audiences, but really the idea of the journal conversation is to come together and talk about it like a round table. But of course, we know we can't bring everybody together to, have the conversation. So yeah, really excited to have you and Stephen.
Thank you very much. I'm grateful. My name is Stephen. I work with Joy News, one of the English networks in Ghana. I'm an assistant editor and the head of the investigative desk. My area of specialty has to do with social justice, accountability, and transparency. But I generally, have this affinity towards, human-centered stories. So if you take a look at most of my works, it involves people, what affects people, its impact. So basically, that's what I would say.
Interesting. Thank you so much. So, in how long have you been doing this, Stephen? How long have you been reporting on
For
human
for
interest issues?
16 years, for 16 years,
Sis- 16.
16.
This 16 years, did you spend it with the same organization they joined you? So I imagine you've moved
No, with
across
with with
different
multiple
platforms.
with multiple outlets. So print,
Okay.
radio,
Okay.
TV. So I became a multimedia journalist.
I see. So just in a briefly, what have you sort of like seen? How has, this area of, reporting on human interest issues, especially health, public
Okay.
health issues, how have you seen it evolve since that time? Just briefly.
Okay. So at the micro level, I would say some of the stories I did in rural areas regarding CHIPS compound. So you visit a CHIPS compound and you realize that it has no access to electricity. So if a woman is in labor, they will either have to rush the woman using unconventional means. Sometimes people will carry them on sticks that had been arranged, and I think it's a reality that cut across many African societies. So they have limited drugs, and because of the national health insurance that Ghana we run, people in these settings come to the hospital with the intention that I don't have to pay anything. And because the government through the Ministry of Health has not been disbursing the funds very early, what happens is that even though you are critically ill in the rural community, what the facility can give you is maybe paracetamol. And And if it happens that you need essential drug that will probably turn your situation around, you would have to pay out of pocket. Even though the health insurance came so that it will be a game changer, because as at the time it was catch and carry. You pay, you are taken care of. With the
Yeah,
advent
out
of the
of
health
pocket.
insurance, the goal was that it will take that challenge or burden from the poor Ghanaian. But I must admit that even though it has apologies with regard to free maternal care, whereby if the woman is pregnant, the health insurance takes care of everything. But if the woman has to deliver through CS, he or she would have to pay additional money, which is let's say $300. $300. And how many
Wow.
how many rural folks would be able to afford that? So it becomes a challenge. So what many of them do is that they visit, traditional midwives who probably would charge, let's say, less than $20 in order to help them deliver. And one of my aunties was a traditional midwife. And always you have a lot of pregnant women lined up, you know, at a beck and call to take care of. And it's because of this issue of cost, where mothers have to pay more in order to deliver. Back to the earlier conversation with the drugs. So you go there, they tell you that we don't have drugs. What we can give you is paracetamol. So what happens is that many people would have to now depend on herbal drugs. And
Yeah.
in the northern part of Ghana, it's very predominant, because poverty is quite high there, and you would have to travel for a long period of time before you probably come to Tamale Teaching Hospital if you are an emergency. So people would want to resort to traditional means of trying to attend to whatever health challenge they have. And if you take a look at the Ministry of Health budget, even though the allocation is high, but many of these monies go into compensation. So if you study the project based budget, outline, you realize that compensation takes a chunk of the money. So the little that's left to invest in capital projects like resourcing the chips compound in, let's say, my village in Kofi Pare, because the money is limited. The chips compound is only a building in name, but in terms of even the personnel, in terms of even the drugs, in terms of even the logistics, beds and other stuffs, it's near, I would say it's totally non-existent. And I've done a lot of stories on chips compound, so I appreciate the reality and difficulties, physician assistants would have to go through in order to meet the health needs of some of these individuals. Then when you come to the
Thank
bigger
you.
facility where, oh, okay.
Yeah. I mean, so there's really a lot to unpack, and some of what you said takes me back to a conversation that we had with your CEO, the CEO of the National Health Insurance Authority of Ghana. I think it's Dr. Victor Bampoe. I hope I'm getting the name right. Remember, I said at the beginning, as part of this whole promoting cross and making sure that we're learning from each other, different African countries. Beyond talking to journalists, we are also talking to the public health experts, policymakers who are at the forefront of leading on this issue. So my colleague had a conversation with him in our curated conversation series. For that one, we talked to policy experts, the public health experts, and really shared great insights around how Ghana was able to achieve 56%, I think, health insurance coverage. So what I hear you say is, yes, why these issues have been there, out of pocket payments and all. At least things have evolved in a way, right? There's an improvement, right? Even though we've not gotten to where you would want the country to be, but at least you are not where you used to be, right? Thanks for those insights, Stephen. I'll go to you, Aisha. How what is the situation in Kenya? What are you seeing, or what have you seen for the past? I don't know, how long have you been in this space? What have you been observing?
Okay, thank you very much. I've been a journalist for quite a while, I think 13 plus years right now. I started working off as a radio journalist, go to TV, then digital, so I'll say I'm versatile. Coming back to our topic, and as a journalist, because since February I've been covering the issue of USAID fund cuts, because it has really, let's say, it has been challenging and affected people. As of now, I'll just say the situation is sort of 50-50, because there are some projects which were affected severely, and there were others they were affected, but then some funds came back, so they, like, the programs were not disrupted. Like, I come from the coastal part of Kenya, and you see, like, there are, like, most program, like 60% of the program used to be supported by USAID. I remember there is a project or a program called USAID Stawisha Pwani. What Stawisha means in Kiswahili is improvement. So you can imagine, by the fact of the name Stawisha Improvement, it was a project that used to improve a lot of people's lives. But right now, let's say they've scaled down most of the operation because it totally depended on USAID for its funds. And like, if I talk about this program, basically it was benefiting both the public, that is the community, and even the journalist. The public, because I remember they had a program which where they were, like, giving sanitary towels to girls on every month, and they could just go to their offices and pick with no questions and no. So you see, even the fact of this program, it even improved girls going to school in the coastal part of Kenya, especially in the rural parts where people cannot even to buy a packet of a sanitary towel that costs like $1, but people are not even able to afford, because if you get this $1, do you go buy food or do you go buy sanitary towels? So you get girls sticking to other alternative, which perhaps are unhygienic ways of getting sanitary towels. And also, there are people that are living with HIV. Initially, they were worries that what if this continues, then what will happen? But then the program came back. I know the programs that are continuing right now under the USAID, the TB programs, that is tuberculosis and HIV. But otherwise, among so many programs, like the Stawisha also used to focus on child nutrition. The part of child nutrition, breastfeeding mothers, is no longer there. And so you see, this has been really a challenge because you get in some parts where there were young mothers and perhaps some children were born being underweight or something of sort. Even some children used to receive this supplement because they couldn't afford perhaps their daily food. So it helped them a lot. But right now they are not able to do that, and they are forced like to use other means in order for them to get food. So you're saying like WHO recommends a child to be breastfeeded from 0 days up to 6 months, but right now you get children being given porridge even as young as 2 weeks. Health experts are warning like perhaps this is not good because the children are uh, they are exposed to other health issues. But what to do? And the supplement which used to be there, with some they even used to offer the milk for the baby. So such are challenges and some stories that I have covered. And I also one particular program about widows. They used to have a fund on that. So these are some of the program like the USAID said like which are not urgent, so they've been cut off and continuing with all other programs.
Interesting. Thank you so much for sharing. I think that sort of, what you shared with what you and Stephen shared are pretty much beyond sort of giving a background of how what has been happening even before the funding cuts came. One of the questions we wanted to ask was how this who is affected the most, right? And it's very clear it's vulnerable populations across Kenya, across Ghana. But again, I think it's cross cutting because we're also seeing similar things in Nigeria, right? The people who benefit most from these programs, who may not be able to afford some of this on their own, right? um, they depend on these programs to access healthcare, to access commodities and all sorts. But when they are caught, they are left to their own. They're just on their own. But I think I would just like to ask. So, just one thing. I know it's cross cutting, but in your opinion, what do you think is the biggest impact of this whole funding cuts?
I could say on my side, the biggest is about the health workers and the community health volunteers or community health people who used to volunteer. Because I'll say, like in Kenya, according to the data, they say like almost 54,000 community health workers who were under a program supported by USAID have been affected. They've been laid off because of the funding cut. So now, if you see that such kind of a situation, these are health workers, qualified health workers, but now they're not being paid. That means already we have a deficit in our clinics and dispensaries, especially the ones which are on a low level, level one, level two, and level three, because that is where they used to give their expertise. So already these dispensaries or health centers are strained. They don't have enough workers. They used to be supported by the community health volunteers or these others who were under the funds, the USAID. So if they are not there, meaning that we already have a deficit even in our public hospitals. So that already creates a lot of things in that chain. There'll be congestion in that hospital. People are not able to get good health care in those dispensaries. So people will also be seeking alternatives, perhaps not to go to the hospital at all or looking for other alternatives in order for them to get cure.
Thank you. So essentially, human resources for health. Stephen, how about you?
So I think, like Asha said, it's no different from Ghana. It's
Mhm.
just that in the case of Ghana, our nurses are currently on strike. I don't know whether you've been following the news here in Ghana. Our nurses are on strike,
Yeah.
and because of these funding issues, for some time now, we've been witnessing mass exodus of health workers for some time, and it become a very big challenge, not in the cities but in the rural areas. In the sense that you have many health facilities, even the main hospitals being run by physician assistants, and many of the skilled workers are not accepting postings into these areas because they
Mhm.
feel that it's not properly resourced. And what are the opportunities for them if, let's say, you leave Accra to Tumu up in the north? Would your children get good education? So all those factors is really affecting, the quality of health delivery
Yeah.
in many parts of Ghana.
Awesome. So, wow, that's it's really interesting to know. You see, again, back to what I said at the beginning, how all of these issues are, cross-cutting. Just like you said, Asha said it, and it's pretty much the same experience that you are having in Ghana on human resources for health. But yeah, just moving on. I guess my next question would be, um, what do you think the public can do? Because a lot of times we tend to focus on the policymakers, but do you think the public, they are involved enough, in these conversations, in pushing for better healthcare, in pushing for better investments, right? Are you seeing examples of that happening already? Because one thing we want to learn more when we have these conversations is what is happening in other places, right? That we can learn from, that others can learn from. So are you seeing that happening already where the public, they are actively involved in pushing for these things, or you think that's a gap that hopefully needs to be filled? Asha, what are your thoughts?
I think there's a gap, especially when it comes to communication, especially from our government, because people never used to know that perhaps these community health volunteers, community health promoters were being paid by a different entity and not the government. So you see, because like it was not clear enough, the government didn't communicate. So there's still a gap. So the public is not even aware that the medication, perhaps they were receiving some of the equipment, even some of the staff that are working in particular clinics are not from the government. So because of not being a clear communication, a clear structure, and the government, instead of coming out clearly and being transparent, they are hiding these issues. So the people are not understanding. So I think the government needs to come out and clearly state that whatever we are witnessing is because of the funds cut and all that. Because you can imagine when it was about the HIV drugs or the TB drugs, the people who were living with HIV already they had this like, are we going to get drugs in the next few months, because they cut there are these funding cuts, so they are not able. Now you are putting even them under mental distress because they're not even sure of their tomorrow, if they'll be able to get drugs perhaps for next week or next week but one, or even next month. So there is a gap, and the gap is about communication. The government needs to come out clear and explain these things, and so that people are able to understand. Those people who are sick, the community is not even put under more stress about where they can find perhaps their treatment, or where they can find their next medicines.
Thank you so much. Stephen?
So I think in Ghana the story is a bit positive. I would say. So health is one conversation that many people are passionate in Ghana. So you have situations whereby well-to-do individuals in Ghana. So what they do is that maybe one of them will adopt a ward and then they will refurbish it. Then there are those that our COVID center, for instance, corporate Ghana came together, rallied, raised funds, and they put up an ultra modern treatment center. When it became evident that if government was supposed to fund it, it will take a lot of time. Corporate Ghana came, and not necessarily corporate Ghana. Actually, you had individual Ghanaians, ordinary Ghanaians. Some were contributing 5 cedis, some were contributing 50 cedis in order
Mm.
to help put up the treatment center. And I think also in terms of the drugs aspect, you have a lot of these local manufacturing companies who are also supporting. So just recently, I think last week, for instance, they slashed down the cost of drugs by 15%, and they directed their members to do so, immediately. And what this did is that when an ordinary person visits the clinic, he asks, oh, the last time I came to buy paracetamol, it was 5 cedis, but your association says that you should reduce it by 15 cedis. How come I'm not seeing any reduction?
Mm.
So you can kind of see that people are involved in addressing some of these, basic challenges, whether at the corporate level or at the individual level. And there've been some kind of awareness, mainly because
Okay.
health is a sensitive issue.
Yeah, thank you so much. That's really instructive, and seeing that happening is commendable. And again, hopefully, other countries see this lesson and adopt one or two strategies to make healthcare more accessible, more affordable for people. So I guess as we wrap up, my final question would be around countries, right? The policymakers who have these responsibilities to ensure people have access to quality healthcare, the citizens, the public. So do you think your countries, our countries really, are doing or what are they doing, if I can ask it that, what are they doing to address this whole challenge? Are they walking the talk enough, or they are just talking? Just briefly.
If I go, I'd like to say, like, let's say, for example, some of the measures the government took in Kenya when the fund cuts hit the country. One of them was they tried like to redistribute. If I take go back to the example of HIV and AIDS drugs, so and the testing kits, ARVs, they made sure like in countries where perhaps it's in counties, that is in the states where like it's needed most, or there's a larger number of people living with HIV where it's needed most, they redistributed the stock. And like in places where perhaps it's not needed so much, I know right now the country's trying to come up with there's this finance bill 2025. If you've been following news, you know, like the finance bill 2024, how it turned out in Kenya. So right now there's the finance bill 2025. So in the finance bill, some of the things they are trying to adjust on matters health, that is basically doing what they can in order to just fill that gap that is not there. But also there are issues that are coming up again, like them wanting to tax medical equipment or some of the clinical trials, you see, as one way of getting money in order to just support these programs that initially were there. And some of the things I think the public is participating is just on social media, being vocal on social media, and letting the government know that we do appreciate this and this, but up to this point we are not happy that you guys are not doing this about health. If it's the finance bill, yes, we appreciate that you're trying your best on the finance bill to improve it, but however, we don't appreciate you taxing medical equipment and clinical trials and all others investors that are coming up. So social media has really been vocal on these issues, especially airing out the challenges that are there on the health sector. Already, I'll say on the downsides is that the government, even in Kenya, has reduced the budget allocation for the country. Even it's not up to past standards with the WHO, because like you find that the budget of 2023-2024, the budget for health sector was 141 billion Kenyan shillings, But when it came to the budget of 2024, 2025, it went even further down, 127 billion Kenya shilling, which you can see there was a deficit of almost 20 billion shillings. Already it's affecting the health sector. So we are waiting to see the this year's budget 2025-2026 and how it will be, because the government is promising that they are going to come up to fill these gaps. But again, is there a political will? Because you find corruption being a major issue when people, especially in the health sector, you find there were drugs perhaps in the store, in hospitals, but then they expire. Yet people here are stranded, they do not have enough medical support. So it's, let's say, a matter of wait and see. But however, they need to be a good political will for the leaders. They need to just walk the talk, not them walking alone and talking alone. All these two need to go in hand.
Thank you so much, Asha, for this insight. It's really important to walk the talk and not just, talking. Stephen?
Yeah, so there's increased investment in the health sector, but like I indicated earlier, much of it is going to staff compensation and other related costs. So there's a downward impact on capital investment. But there have been some substantial investment in hospitals. So, and because it became a major, political issue, after COVID, the government promised to build 111 hospitals, and it became a very political issue. So government was forced in order to look for funding to finish some of the projects, but many of them have not been finished. Many of them are white elephants. Then the other
I
bit
see.
has to do with the USAID cut. Government is still struggling to look for funds to fill that gap. So partly they are doing well, partly it's also all talk, because the USAID cut fills an important segment of healthcare financing in Ghana. And if that still lags behind and it's not prioritized, you can imagine the impact.
Thank you. Thank you so much. I guess that's what you said, leads me to the question I was trying to frame earlier. Your final thoughts and reflections. What needs to change? Like, should we even be having this conversation around, the funding impacts of the impact of USAID funding cuts and, all of those other reduction in official development assistance, and or should African countries be waiting? Yes, there's nothing wrong with development assistance and all, but should we be waiting, and depending on this alone, or should we take this as an opportunity to actually do what remember what I said at the beginning. This conversation has been happening a long time around, the need for us to take responsibility and invest in our healthcare. Shouldn't this be the case? Should we still be having this conversation around, development assistance and all? Those should be additions, right? Nice to have, if I can put it that way. But ideally, shouldn't it be a situation where we are owning our own things, investing enough, in our healthcare? So whatever gets added, we know it's an addition to supplement, but not depending solely on it. Do you think this would be an opportunity for that to start happening in Africa? Just your closing reflections on that.
Okay, I think with the USAID funds cut and also some of the European Union, European countries reducing on their funds, we should take this as a lesson in Africa, not like to be dependent on foreign aid. It's not a bad thing, but if you become too much dependent, then everything goes wrong. Because you can imagine the way Trump did the cutting, it was just, it came the other day and the next day everything is not working. I know there are some websites, the government of Kenya, on important health issues. Like in 2021, there was this funding of PEPFAR, and you can imagine, like, when PEPFAR decided to close it's doing its programs, and most of the information on health, personal data of people went just like that because PEPFAR decided that they are closing everything, and personal data of people and everything went just like that. So this is a wake up call. Our leaders and everyone in Africa, we should be working towards achieving and realizing our own health goals. We are capable because if you see the rate at which we're exporting labor, most of the countries, Western countries, even Eastern country, when the first job they want to export, it's the medical field. Nurses, doctors, specialists in the medical health, those are usually the first people you want to export. So it's a sad state when you look at times in our country, in Kenya, the president saying and being very proud that we are exporting labor to other countries and being proud of that. No, that shouldn't be the case. We are the ones who taught our doctors, sponsored them with our own finances, our own taxes. So they should be working for us, and we should feel proud that these are our children, that they've worked hard and they are here. So this is a wake up call. Africa, we should be working towards achieving our own health goals and not be depending on other countries for our own health issues. Thank you.
Absolutely. Thank you so much for that thought. Steven, what do you think?
Yeah, so to borrow from Asha, we are capable, and I keep referencing COVID. It was a game changer. When the politicians realized that they couldn't fly out of Ghana, they started investing in healthcare. They started investing in medicine resources. They started investing in technology, and we all saw the impact. So it isn't the case that governments are not capable. It's just about priority. They just, once they don't see the political capital in it, and there's an opportunity for them to fly out to seek medical health care, they don't see it as a priority. So I think, and I agree to a large extent with what Asha said. Once attention is taken off development assistance, and African governments say we want to prioritize this, you would see marvelous changes in healthcare delivery. Trust me.
Thank you so much. I really appreciate the insight. So my key takeaway from this is actually these final reflections from you. We don't have to wait for major events like this to happen before we prioritize healthcare. It should be a norm because, like the saying goes, without health, we really have anything. We don't have anything. We have nothing because people need to be responsible to work and for a productive society. So yeah, we really hope they listen. And beyond this whole conversation around the impact of the funding cuts, even beyond now, it would be a norm, right, to take healthcare seriously and invest in it. Thank you so much, Stephen. Really appreciate your time and the insights you shared with us. Thank you also, Asha. Really appreciate.
Thank you very much for having me.
All right, so that's it for today on the Journal Conversations episode of the Break It Down podcast. Really hoping that we all take this lesson and help amplify this conversation that we need to invest in healthcare as a continent. We don't have to wait. Even after events like this happen, we need to keep the conversation going, right? Keep it alive as citizens, as healthcare providers, private sector, wherever you are, you have a role to play. Please do share. If you have a comment, do send it to us, podcast@nigeriahealthwatch.com. We'll be happy to engage with you. If you have thoughts around this, please do let us know. We're very active on social media. You can share your comments, share your experiences as well. How are you? What is happening in your space? We want to know. We want to make it part of the conversation. Until the next time, thank you and bye-bye.